again, it's the progression, the typical, the signs and symptoms what these patients will show. For example, with Alzheimer's disease, the first signs is really a short-term memory loss. They just inability to remember names, what was said a moment ago. Typically, they can't remember what they had for breakfast, but then some of us have similar problems too. But the point is it's short-term memory, and then it progresses in Alzheimer's disease to more of a difficulty with fine movements, with visuospatial. They have difficulty recognizing familiar places. They get lost easily. Eventually they forget even to or recognize their loved ones or people. They may know, I know who you are, but I don't know. Not only don't know your name, but I don't recognize you properly. So there's a typical progression in Alzheimer's disease. Lewy body dementia is a totally different type of dementia. People have oftentimes more a Parkinsonian, or have some Parkinsonian problems. They're stiff, have difficulty walking. They tend to fall early on. And the classical sign, or classical symptom really is that they have hallucinations. In fact, they see people, they talk to people which aren't there, and they will tell their loved ones, why don't you see these people? They're all sitting on the sofa. And interestingly, these people who are sitting on the sofa are small. I don't mean they're children, but they're just small. If you ask them, when there are 20 people sitting on the sofa, there are all these small people sitting there, or small animals. So somebody who has these hallucinations, this is not an Alzheimer's patient. This is a typical Lewy body dementia patient.